Hello, it's Dr. Rhonda Johnson, and today is Wednesday, September 30th, 2020. Last night, I watched the presidential debates, and I heard former Vice President Joe Biden cite a horrible statistic about this COVID-19 pandemic. And he said 1 in 1,000 Black Americans have died. And I knew it was bad, but I had never thought about it in those terms. So I did a little fact checking, and I came across the source of this data. It's a study published by APM Research Labs, and I will reference that study. But the study shows that as of mid-September, 1 in 1,020 Black Americans has died. And the study also showed more. It said that Black Americans continue to experience the highest actual COVID-19 mortality rates nationwide, more than any other group, more than twice as high as the rate for whites and Asians, who have the lowest actual rates. And the study showed when they adjusted for age differences, that the mortality rates were even greater when you adjust for age. For COVID-19, the mortality rate for Blacks, when you adjust for age, is 3.4 times as high. For Latinos and Indigenous people, it's 3.3 times as high. And Pacific Islanders is 2.9 times as high. And Asians is 1.3 times as high as for whites. And so adjusting by age shows that younger Black, Latino, Indigenous, and Pacific Islanders are dying of COVID-19 far above white Americans, despite the fact that they're relatively young, and age is supposed to be a protective factor against dying from COVID-19. So regardless of age, if you're Black, Latino, Indigenous, or Pacific Islander, you are experiencing, that population group, a higher mortality, a higher death rate from COVID-19. Now, why is this so? I'll leave you with the conclusions that the authors of this study reached, and I will say that I agree. So the authors note that depending on that community, this may be to numerous reinforcing factors, such as a higher likelihood of contracting the virus because of more people working in essential jobs, or inability to work from home, or they live in geographic areas where housing is highly populated and dense, or they live in congregate settings such as group homes, treatment centers, or in correctional facilities, or that people have to access public transportation where they can have more opportunities to be infected by this virus. It may also be due to poor outcomes after acquiring COVID-19, because they may lack access to testing or have a higher prevalence of underlying health conditions such as diabetes, high blood pressure, obesity, and asthma, or that they receive delayed or poor medical care, perhaps because they lack health insurance, or because they distrust healthcare providers, or because they're receiving inferior healthcare. The authors of this study note that the disparities in COVID-19 are compounded by elevated risk from the American systems of housing, labor force, healthcare, and policies that are the result of systemic racism. So those are the facts. Now, it's that simple, that a disproportionate number of the confirmed dead from COVID-19 are Black. But there's more to this story about the impact of this pandemic on indigenous and people of color. Now, I'm no longer citing that article. This is my opinion here. The story includes ongoing physical suffering of people who have had COVID-19 and are not fully recovered. The story includes families who have lost parents, grandparents, relatives, children, neighbors, pastors, friends. The story includes a widening educational gap of children who are being left behind. The story includes an untold mental health burden from this pandemic. These facts don't account for the huge disparity in Black unemployment that was only worsened from this pandemic, and the total stress that particularly Black Americans feel because of this COVID-19 pandemic and the social unrest that is occurring simultaneously. So what can we do? And originally I had taped this message, but I took it down because I didn't like my response to these questions, to the question that I asked. What can we do? I don't have answers for how to dismantle systemic racism and all the problems that it creates. But I do have some suggestions that we can take as individuals. Number one, we can make our voices heard on November 3rd at the polls when we have to vote. Either vote by mail and get your mailed-in ballots, or vote in person and be prepared to vote in person and exercise all the COVID-19 pandemic prevention practices. We can take care of one another, continue to look out for each other, and we can seriously practice the 3 W's: washing our hands, watching our distance, and wearing face masks. Number 3, we can avoid high-risk events, such as dining indoors, going to bars, clubs, parties, big gatherings. I know this is painful, but I personally would rather have a short-term sacrifice than be a memory. We can also take vitamin D supplements because it's known that especially during the winter months when there's not enough sunshine, people with dark skin, that's Black and brown people, and wearing clothes that cover your body surface all day long in the winter, those are factors that contribute to vitamin D deficiency. The experts recommend that the daily dose of vitamin D not exceed 1 to 1,500 international units a day for infants, 2,500 international units a day for children 1 to 8 years of age, and don't exceed more than 4,000 international units for children 9 years through adults. That's taking vitamin D from all sources. We can also get our flu shots as soon as possible. We can write to our elected officials to demand more testing in communities of color and to demand support for continuation of the Affordable Care Act. We can educate ourselves on the signs and symptoms of COVID-19 so we're more informed. If we have conditions such as high blood pressure, diabetes, asthma, we can take our medication and follow up with our doctors. For those of us that are overweight, we can continue to try to lose those excess pounds. We can also do things to lower our stress, such as get regular sleep, get regular activity, and turn off the TV and internet sometimes. We can stay connected to the things that give us joy. We can avoid smoking, excessive intake of alcohol, and excessive intake of sugar products, since these are things that are known to weaken our immune system. So those are individual actions we can take to help minimize the toll of COVID-19 on our communities. But again, doing all those things can't stop us from getting COVID-19. The three big things are wearing a mask, washing our hands, and watching our distance, and avoiding events that are likely to be high-risk activities for COVID-19. So this is Dr. Rhonda Johnson. My views are my own. Stay safe, stay connected, stay well, stay the course, and have a blessed day.